17.2 have been positive. 17.2% of the samples we have collected have been positive. So because of that, we have this
karibu sana.
Asante sana.
Apologies.
Apologies.
Karibu.
Thank you very much.
okay, so welcome.
Thank you.
So we're saying our TB positivity rate is actually very high from just the samples we collect in this facility alone, not in other facilities. So we have a positivity rate of 17.2% this year. And so that tells you that us referring samples, maybe we are not reaching the whole population. So as Daktari was requesting, we want to support that. If we can also be supported from the ministry, if you find it in your capacity to do our diagnosis, bacteriological diagnosis from this site, because we have the space and we have the staff capacity. We get a gene expert machine and we diagnose on site, then we feel we can be able maybe to reach a bigger population for that. On top of that, because of where we are living, we realize there's a vulnerable population, and these are the street families. So they used to come and seek services on and off from our facilities. And we realize occasionally they would come in very late. They either come in end-stage HIV or they're very sick with TB, pneumonia, and other diseases. So we started engaging them. So the moment we started engaging them, we realized they are coming in more and more and more to the facility. So you engage one, you know, there they live in what they call a base. So a base can be a corridor and then it's demarcated and 10 of them are living in there. So you realize if one gets TB, they are likely to infect the whole population. So unfortunately, there is just one across the road here, next to Kiboro Primary School. And from that base, one time, we diagnosed an MDR client from there. And when we invited now the other family and peers who live in the same base, we got 15 other positives from that site. And so we realized that population is disadvantaged. They do not know where to seek care. And so we opened our doors to them. With that, the population has grown. Now they came with other challenges of where do they take a shower? Where do they get a washroom? And such other challenges. So we from our old clinic, we put aside a room for them and a washroom. And the challenge now we have is the clothes to change, because we rely fully on donations from well-wishers and our staff mainly. So especially the men, they're really challenged, because women, you know, you can adjust waist here and there, a blouse, but the men now, if the trouser is really baggy, I mean, you really can't walk in it. So that's a big challenge for them. But we've embraced that community, and now we want to go wholly and just have a program for them, because they have other issues. They use drugs, they inject drugs, and they will get sick like any other member of the society. So we will show you this same building. We incorporated a space for them to continue getting the same services. But as you can see, this area you don't get really much space, so we will squeeze in there with them. So with those few remarks, that's the brief history of HIV in America.
So just karibu sana Mheshimiwa. Listening to the story here, Mheshimiwa, this team has done fantastic. We want to thank the management of for the good work that they have done. They have given us the story 13 or 15 years ago, where they were and where they are now. And we're very happy for what they've done. As a government, we are going to support you. Good message of met. I think we are going to send a team here to come and especially in the ones of NASCO. You've said we're dealing with them already. The TB team should also come here and then assess the facility and see how we can partner together. The government and AHF can partner with this area, because looking at the population that we are serving, it is a population that the government is trying to reach out. And if indeed you are going to be the bridge, then the role of the government is basically to come in and ride on what you're doing and then bring in other government services so that we can serve our population. We shall also try to bring in the social protection team so that they come and look at that most vulnerable groups that we are trying to address, because of your limited resources, how can they then support this group? So it is important that we bring this whole of government approach to this as well, so that we're able to support you where we have government programs like the social protection, the Department for Children and Adults. So we are going to make sure that we work together very closely, and I'm happy that already are working with the National Syndicate Council. We'll continue supporting you in that area, and I think we want to see how we can then support your outreach programs, because it is really important that we support your outreach programs, listening to what you're doing, not only just in Nairobi, but across the country, and we want to support so that you're able to expand and reach more. I'm very happy that we're doing this also as we expand your facility. I so believe that you're registered for the new body, that social health insurance. You're aware of what we have, the programs that we have there in terms of funding. So you should be able to benefit in this new government program. I'm sure you're registered with NHI.
Yes, we are.
You are. So again, with this new, was to be a critical chronic disease fund, will be able to come and support you. So the people you're dealing with are suffering from chronic diseases, right? So it is important that you align yourself with the government programs, make sure that I'm happy that you're compliant in terms of registration, which is a good thing. And you have all the experts that are required to deal with it. So we shall support, especially on the manpower and not the request of the gene expert. It's good that you're going into the new technology. It is important to leverage on technology so that you're able to provide efficient and quality service to our population. So that I shukuru sana for inviting me also, and I'm very happy to meet Mheshimiwa once again. I think our meeting also is in Mombasa. But it's good that we have all been in different places playing our roles, and I'm very happy that this is a facility that has taken time. You have invested your resources here. Thank you, Mheshimiwa. Karibu. Yes. Maybe you can tell us one more.
Thank you, thank you, Daktari. First, to apologize for coming in a little late. I think my driver allowed me to fix the routes until we got here. But as I have listened, or the little I've listened, I want to add my voice to PS's voice to actually congratulate the chef for what they're doing. PS, the health is one of, in fact, I treat it as the most important human right next to life. If you don't have health, there is very little you can do. However rich, however poor you are, there is very little you can do if you don't have health. So those who provide services in health are extremely important. And for this country, beyond the public facilities, the civil society and the faith-based organizations that fund health actually run close to over 50% of the services, and they are the ones that can be accessed by the vulnerable. They just talked about the street families. No street family can walk to the camp and get services. No street family can walk to the obvious in developing countries. We've not reached that age where we can say our public health facilities will be able to carry on. So we need to encourage organizations like AHF, which are not just in Nairobi, they are in many other parts of the country and providing services. I'm particularly happy that they are able to provide my favorite group, the adolescents. Most of those street families are actually adolescents who we don't want to recognize, we want to treat as children, but they are engaging in activities that ought to facilitate them to get access to services. But we are busy as politicians and religious people arguing about what we give them and what not to give them. And we will support, calling a group, Gonna PS, that will be supporting the science behind the Ministry of Health to try and bring everybody on board. And for us to be able to persuade each other that adolescents are human beings with human rights, and they have families, even though they shouldn't be having those families, and access to health is the number one thing that they need, and we need to invest in. We will also in Parliament of resources to the health sector and related activities for the excellent work.
Si lazima na mkono.
Tunasherehekea
Karibu sana, this is the champion.
mechi ambayo inaendelea sasa hivi ni mechi ya
As the government.
mechi ya pili kati ya Blue Angels wasichana kutoka Kariobangi Sports wasichana kutoka Kariobangi. Leo ikiwa ni siku kubwa, siku ambayo Maisa wanasherehekea their 35th championship. 35th championship. So it's their 35th anniversary. Their founder, Mr. Bob.
And as we celebrate these 15 years, I'm reflecting on the AHF Kenya program. That's a journey that started 15 years ago in 2008. I do remember very well that AHF Kenya was our 4th program. We're in 13 countries right now, taking care of close to 1 million patients. And the Kenya program is our 4th largest program in the Bureau, contributing over 100,000 patients to this pool of patients that we see. That said, I know that the program had very humble beginnings in 2 counties, that is Makueni and Mombasa, and we only had 2 clinics that were responsible for at that point in time. But that said, I'm very proud to see how much progress has been made over the 15 years. We've now grown to 10 counties in Kenya, and on top of that, the countless lives that you've saved and the people living with HIV and AIDS that you've taken care of over these years has ensured that that patient population is thriving, is happier, and it's all due to the tireless efforts that you've made over these years. And so I really want to commemorate this day and also thank you very much for helping AHF to live its mission within the Africa Bureau. But that said, I think much as we celebrate these wins, we still have a lot of work that needs to get done within the Bureau. And this work in general helps AHF to achieve bigger goals for ensuring that the mission is lived. As we mark these 15 years, let's not forget that there's still a lot of work that needs to get done. So let's take time to celebrate, but let's remember that our voices are very critical at this point in time. On behalf of our patients, with our patients and the communities that we serve, we need to ensure that our voices are amplified in the areas that are most needed in the HIV and AIDS fight. One of the most critical areas at this point in time is the funding gap. We've seen that more and more donor funding has either reduced or has stagnated, or that the donors are fatigued. So it's imperative that we continue to raise our voices and demand more of our governments and of our communities to do better in funding HIV and AIDS, because we are close to the last mile. However, with the funding gaps that we face, we see that we won't be able to get to the control of HIV and AIDS in any time soon. The second critical area is in relation to the new HIV infections that we are seeing. We see these infections mostly affecting the youth and mostly the young women and girls. And yet these are our future leaders. This is the future generation. So it's imperative that we can curb these new infections. And what does that entail? I think that's a collective effort that involves the young people themselves, to sensitize them about HIV and AIDS, and to ensure that those who are making decisions about their sexual health are making decisions that are based on information, and that we can protect the new generation from getting new infections. The other area that is very critical and that we should continue to pay attention to is relation to prevention. Prevention has taken a back seat, unfortunately, but it's very critical that key prevention messages continue to take the spotlight in the fight against HIV and AIDS. Prevention methods like condom use, that we can revive the prevention work that was very critical in reducing infections in the past. We need to make sure that prevention takes the center stage as we focus on more efforts in the future. We are also seeing a surge in the number of STIs, and we're also seeing that retention of patients in care and treatment is very critical in the control of HIV and AIDS. The more patients stay stable on treatment and stay adherent to their medications, the more we can be able to see that patients' viral load is suppressed, and we can begin to see the effects of fewer new infections in the community because of reduced community viral load. And so these, amongst many other areas, are important for us to look forward to as we keep the fight and our advocacy up. And so as we commemorate these 15 years, I know our work is not yet done. I encourage each and every one of you, the staff, our patient communities, our partners, and both at government level and within the communities and other civil society partners, to ensure that our strength can be seen in the numbers and in the voices that we utilize to bring the messages forth. So on behalf of the Africa Bureau, I want to congratulate you on reaching this milestone, but I know that our work is not done. So I thank you very much for the efforts that you've made over these years, and I know that we are here to help you and support you as a country team, but also our work is not done on the whole, so we look forward to many more efforts in the future. Thank you, and God bless.
Thank you. Yes, now the country director is going to give you a tour of the facility from where the patient comes in, or client, up to where we go. So please.
I think so.
Warembo kutoka Isili, Pro Legends wanamenyana na Kariobangi Sports, wasichana kutoka Kariobangi. Asante sana. DJ, fanya venye ulifanya Italy last week.
We wait for too long to complain. We wait for too long to complain. So because of that, our guard runs to the queuing.
Na sisi, manake siku ya leo ni siku kubwa, siku ambayo Maisa inasherekea their 35th championship game, na wako sponsored na wana AHF AIDS
can have various ways of studying. One is as well, the one is just collecting medicine. Just wants to collect the medicine. It's an one who wants family class, is an expectant. So they will be seen from our reception.
So to score wengi wale tunaingia kwa tafadhali. We are not part of the
because once you're in Nairobi County, and we appreciate the support we get from Nairobi County, we do enjoy support supervision in some countries. So everything we do, we seek guidance from the county HMT. So our nurses will advise that this is the official nurse station. So from there, we may need
Umechukua sana. Make sure ukitoka hapa siku ya leo.
accident has happened. How do you offer the blood emergency care? You wait. So this is your emergency group. We are doing that offer emergency services. Yes, yes.
Very fast.
It's okay. I'll do it very fast. We're getting here. So PMCCT means prevention of mother to child transmission. So we have Margaret, another nurse. So this room we set it up for the mothers and their babies. So once a mother comes in and their babies, they get all the services a mother and baby require. So they get family planning, they get cervical cancer screening, they get immunization vaccine, and we receive our vaccines from the government. So we are compliant on that. And they get everything else. If they are unwell, we treat our babies with the for common ailments. Again, babies, we do prevention. So remember, if a HIV positive woman is pregnant, they also require to prevent their child. So they'll offer that prevention messaging and medicines from here.
This is a setup even for.
So our waiting day, we have set a corner there for the children.
Funzo zaidi kuhusiana na ngono, premarital sex, wajue mingi. Vijana wetu tafadhali na wasichana wetu wadogo, muweze kutembelea professionals pale mpate mafunzo zaidi. Leo ikiwa ni siku kubwa, siku ya Maisa Championship 2023. Wana Maisa, they are celebrating their 35th championship game siku ya leo, na hii yote inaletwa kwako na wana AHF, ikiwa live kwa wa YouTube handle at AHF Kenya, YouTube, Facebook, Instagram, tuko live. Shukran sana kwa watu wetu wa video coverage kutuweka live. Tunasema ni asante sana kwa kazi safi ambayo mnatupatia. Mechi ikiwa ni kati ya Kariobangi Sports, warembo wetu kutoka Kariobangi wanamenyana na warembo wa Pro Legends kutoka Isli. Siku ikiwa Maisa Championship 2023.
Also, those are part of our challenges. We started sipping in water and got damp and dark, so we had to relocate them. So we set aside the bathroom. This one we set it aside like the factories. So they'll be coming, they take a shower, we're going to put for them clothes lines here and wash basins. They can also wash, because we mentioned we have challenges of the change of clothes. Sometimes we don't have enough. So we are going to ensure they have everything. They can also wash what they came in with and collect the next day. Then they'll be accessing through this.
Or they're accessing through this?
Yes. But they're not always coming from here. Sometimes we just need that sanitary service. Yes. The youth room. The youth room.
After Vincent, maybe I'm
you have everything that the staff will have. You have internet, you have computers, and you also have free access.
I think we're not going upstairs because of time. We can do the media brief here with all the media, and then we finish it from here because by the time we're here, the same thing you see upstairs. Ungekuwa na machine za NASA na maduka together. Alright. So please, the media who is in charge has managed to citizen. Thank you. And a first party gun. Hapo kwa sawa. Hapo ndio muonekana. Are you okay?
Yeah.
Let's start.
So morning. Yes, we are here today and it's a week time to the World AIDS Day. Basically we are here to help, to join hands in fighting HIV in Kenya, and with the rollout of UHC, we anticipate that maybe the government will bring something to help in fighting HIV in Kenya. So maybe if you have statistics apart from what she maybe say on the statistics, maybe on what the government has to help in fighting AIDS through the UHC program. And maybe if there are statistics, then maybe you can highlight about that. And what the clinic that we run today will help in benefiting the people of Mathare and even Kenyans as a whole.
Thank you. Let me start by introducing myself. My name is Harry Kimtai. I'm the Principal Secretary of State Department of Medical Services. Today, I'm honored to preside over the official opening of the AIDS Healthcare Foundation building here in Mathare, and I've also been taken through the journey of the AIDS Healthcare Foundation, where they've started here in Kenya for the last 15 years. And we are very happy with the progress that they have made, because they have started with 2 counties, Makueni and Mombasa, but now they expanded to 10 counties. And we are very encouraged on the investments that they have put in place, specifically on this building, that they are going to cater for more than 100 patients per day, and also they are going to serve more than 300, a population of more than 300 within this 300,000 within this area. As a government, we are very happy to partner with the AIDS Healthcare Foundation. We are going to support them in TB drugs. We are also going to support them with the HIV AIDS drugs, so that together with the Nairobi County, and any other support that they require, the government will provide that support. We've noted also that they are not only just serving sick people, they are also serving, they have made a provision for the street families so that they can also support the street families, which is really encouraging. And I've discussed with the management, we are going to have a joint approach in this, where we also have the social protection department coming in to support this institution because of the vulnerable population, the street children that they are also supporting. I want to say that as we go towards the World AIDS Day, we celebrate World AIDS Day, I want to say that we are facing a lot of challenges, especially in the AIDS area, in the sense that there are a lot of youth now who are being infected with the HIV/AIDS, and it is really a challenge for the government now. We are very happy that this institution, this foundation, have programs for the youth, that they will be engaging the youth so that they are able to counsel them, support them at this particular time, because they are the ones now who are most vulnerable in terms of getting infected with HIV. The other program that the government has done to support such kind of institutions that have come in is that the new laws that were passed recently, one being the Social Health Insurance Fund, because previously we used to have challenges of chronic diseases, but now there will be a fund that will take care of the chronic diseases. HIV, AIDS, TB is among those chronic diseases that the government is targeting to support. So they will be getting, as long as they are registered, they meet all the obligations, then they will also benefit from the chronic disease fund. They have also told us that they are also offering other services, not just only for the HIV/AIDS, so they are offering other services for other diseases. And that also comes in under the primary health care fund that they will be able to benefit from. So, as under the social health insurance, this institution is going to benefit a lot. And that will also help to improve the facilities, improve the service within this area. Yes.
So it appears there's speculations that in years to come, maybe USA will continue in terms of drugs for AIDS. Maybe as a country, as a government, what are your plans towards this? What is going to be the fate of our people?
We've been working with the partners, the PEPFAR, for example, the Gavi. We have been having the Global Fund supporting government in fighting AIDS. And we do know that we have a program that initially it was meant to be by 2027 that they will withdraw their support, because that was the arrangement, that was the agreement between us and the partners. However, because of the challenges that the government is facing currently, especially on the economic side, the fiscal space challenges that we are facing, we've been engaged with the partners, and we've agreed that until 2030 is when they will stop the funding and where the government will be able to take over. But you can see what the government is doing in the health sector is they are doing a lot of reforms. Key among them is a social health insurance. That is the one that is going to support the government in achieving its universal health care coverage, and where the donors will have withdrawn their support. So once everybody pays in the social health insurance, we're going to do that. Now that we have a new board, we're working on the regulations so that we're able to register all the households to be able to benefit from the social health insurance. Then we will be able to take care of our health care within the country without the support of development partners. So Social Health Insurance Act will support us in that area because we've made a provision for it. The other one is also the Facility Improvement Fund, where we are working with the counties, that the revenue that is obtained from those health facilities are retained within the health facilities so that they're able to continue procuring the drugs to treat the patients. So you can see we've put in laboratory measures in terms of legal framework to support our healthcare system, so that when the donors leave, we'll be able to take care of our healthcare system.
Lastly, what are the 10 counties that you just mentioned, and why did you choose them?
I think it is the partnership that decided the AIDS Healthcare Foundation started with the 2 counties, I said Makueni, Mombasa, but they have told us that they have expanded to Taita Taveta, Kilifi, Kwale, Homa Bay, Turkana, Nairobi itself, we can see Murang'a, Kisii.
Next year we are going to Migori.
And next year they are going to Migori and Nakuru. So that shows that the management of this foundation are geared to support the government programs, and they are aligned to the government agenda of providing universal healthcare coverage. We encourage more of such foundations, more of such providers to come on board to support our government and our county governments to ensure that we support the county. But I think what we have done basically so that we're able to attract more of this is the amendments and the new laws that we have passed, the legal framework, where most of them are now going to benefit, because those who are eligible for claims from our social health insurance will be able to benefit, and also the framework that we put in terms of government support to the social health care. To provide universal health care is really critical. So we call upon the private investors, foundations, and individuals who are able to invest in the healthcare system to come on board, because now we've made legal amendments and also passed laws that will be able to support their investment in the health sector. Yes.
Maybe finally, ambiguous a little, but I think you have something to say about this. Basically, I've heard a story I've been doing about women suffering in marriages. So their men have been forcing them to have anal sex. And they realize because of them that they've been having problems mostly associated with these STIs and AIDS. So as a government, maybe because this might be a new way of transmitting this disease faster, do you have maybe something to do? And maybe if now that it has come to your ear, can you maybe have something to regulate this so that maybe women have a voice to speak about it? And because now it's happening in our marriages, are we at risk maybe increasing the people that are getting infected with HIV?
I think we have the National Syndemic Disease Control Council that have come up with the programs, policies and strategies to ensure that we address those challenges. Of course, we have challenges now in marriages, gender-based violence. We have a lot of other things, abuse. But we have come up with strategies and policies that are able to address that. I think we have the CEO of the National Syndemic Disease Control Council who come up with these policies, especially on HIV/AIDS area. I think I can give her to respond to some of those issues so that she can tell you specific interventions that have been put in place.
Thank you.
But finally, we are just a week away from World AIDS Day this year. What's your message to Kenyans generally who are infected with the virus? What is your general message?
The general message is let us not drop the ball. As a country, we have made a lot of strides in fighting AIDS. We've achieved a lot. We've seen in some cases, some counties, their prevalence and of AIDS have gone down. Areas where counties which had high prevalence cases have gone down. But I think we are seeing also in other counties now, they are emerging cases, increasing HIV infection cases that are going up. We want to call upon the public and request them that let's not drop the ball at this particular time when we are just about to end HIV/AIDS in our country. Let's ensure that we continue with the messaging of AIDS so that people are aware, the youth are aware that we've got to join hands to fight HIV/AIDS in our country.
When do we intend to stop maybe new infections in the country? What is our limit?
Maybe additionally, maybe we can talk about prevention of mother-to-child transmission as well.
Of course, what you're doing on the prevention of mother-to-child is that we're investing now in most of the facilities where we have equipment so that when they go for their clinics, they're able to be tested, they're able to be informed, they're able to be supported, and mothers are actually counseled on how to prevent the mother-to-child